There are fresh calls for the federal government to overhaul Australia's medical ethics regime and make a return to the Hippocratic Oath as doctors struggle with red tape. Health professionals say their relationships with patients are eroding as they try to stay in line with a bureaucratic mandate that requires them to acknowledge colonisation, systemic racism and cultural diversity while practising medicine.
When Dr Gary Galambos graduated from the University of New South Wales Medicine faculty in 1992, he did so with a firm understanding of the Hippocratic Oath.
We love the Hippocratic Oath. It's 2,500 years that doctors have been pledging an oath to care for their patients, to prioritise their patients, to do them no harm.
In the years since Dr Galambos was a medical student, the symbolic and sacred Hippocratic Oath, once a staple of the trainee doctor, has been twisted and tampered with by a series of government committees. And now it looks like this, a 27-page political doctrine prescribing doctors a course of social activism. Now part of the official government ethics code for doctors, an instruction to preserve cultural safety by acknowledging colonisation and systemic racism, social, cultural, behavioural and economic factors which impact individual and community health.
Taylor, I think it does the opposite of why the oath was created. It makes doctors feel like they're obliged to follow some committee-led code and tick box exercise rather than about the relationship between the doctor and their patient.
According to federal government regulators, the rulebook aligns with the International Code of Medical Ethics, administered by the World Medical Association, headed up since October by vocal climate change campaigner Dr Lujane Al-Kodmani.
Climate change isn't an environmental issue. It's a health emergency. Around 2.2 million children face its impact. And by 2030, over 100 million people could plunge to extreme poverty because of climate change.
The WMA's Code of Ethics includes instructions for doctors to practice medicine in an environmentally friendly way. Now practitioners like Dr Galambos say, bring back the oath.
I'm concerned about the future of medicine, that it's affecting training, it's affecting whether doctors are even willing to enter hospital-type environments where these bureaucratic practices have reached extreme levels.
Taylor Auerbach, Sky News.